For the first 3 years, you're in so much pain, and you're on morphine and OxyContin, Arthrotec, and then they want to put you on antidepressants. And so I had my first hip surgery done, and then I was off work for about a year, and then I went back to work, and I was at work for about a year, and then my left one went. I slept in a lazy boy chair for 3 years. My life seemed like it was just over, because all I was doing was sitting in the chair and taking drugs, and I had no life. I got an appointment in Red Deer to see a doctor, and he told me that if I lost 25 pounds, that I would just phone him and he would set the surgery date. It was tough to lose that weight, but I did it, and I phoned up the office and I talked to the nurse, and the nurse says, well, you aren't even on a list. I phoned my daughter, and she phoned the nurse and talked to her, and she said that there was nothing she could do. So my daughter phoned my son. He made a mistake of saying that if he found out the doctor was going to be gone for a month's holiday, and he said, if anything happens to my mom in that month, he said, I'll sue you. And that was the wrong thing to say, and he apologized to her. She went to the doctor with us, and that doctor, he said, I will not do her surgery. So my daughter went online, and she found Timely Medical in Vancouver, which is Rick Baker, and within 2 weeks, I was flying to Oklahoma to have my surgery. And the minute the surgery was done and I woke up, that pain was gone. It was completely gone. I'm sorry. We feel that our government has let us down. The doctors are there, they're supposed to be there to help you. And it's insane to let you wait all those years. I'd like to thank the states for giving me my life back.
I'd like to thank the states for giving me my life back. Here's a woman who for 3 years had to sleep in a chair in order to get into a position that she could fall asleep. And they threw morphine at her. I mean, and she was able to come down here in 2 weeks and finally get relief.
That's because of our monstrous profit-driven system here. Profits have driven a system that is abundant with health care. Now, it's not accessible to everyone in the United States as much as perhaps it could be if we had a less regulated healthcare system. But we still have a system that is driven by profits, and profits mean people invest in clinics and hospitals, and people become doctors and nurses still in the United States. So we have a good supply of healthcare. I can say that you know, in Canada, it takes 4.8 weeks to get a simple CT scan. That's an incredibly routine procedure here in the United States. If you need one, you walk into a doctor's office and they determine you need one. You're probably going to not even leave the office. You'll probably get it that afternoon at the office. So that's the difference between what's available in Canada versus what's available here.
Yeah, the profit motive. When I heard Obama talk about the new public option, the idea that we'll be able to build an insurance company, a government insurance company. It'll be just like the others, but we won't have that evil line item called profit, and therefore that'll be nothing but savings. Why doesn't that work?
Because nobody has any incentive to cost minimize, to control for fraud, to offer new products that are risky that people might like. It's just the same old, same old. That's why the Social Security system is still offering the same old plan that it offered in 1930. The computers have never been upgraded. They still make mistakes. It's why Medicare isn't really an insurance plan. You realize if you're in the hospital for too long, Medicare runs out, And there are tens of thousands of people every year who have liabilities in the tens of thousands of dollars under Medicare. The government just says, sorry, you're out of here.
So in other words, profit is the motivator to find cost savings, to find new
ways to
innovations, new inventions, new pharmaceuticals.
And to take risks. I mean, don't miss the fact that she was retaliated against because her son said, you know, you can't do this to my mom, I'm going to sue you. The doc dropped her. The doc has no incentive to take any risk. We see people being retaliated against in Medicaid all the time. Classic case is somebody who needs home care. It comes from Medicaid. And he'll say something like, what do you mean you're not going to send somebody out to get me out of bed for the weekend? You know, I need help here. And they say, we're not sending anybody. And he curses him out. He gets written up as a disruptive patient. If you're dependent on the government, you toe the line or you don't get care.
Let me ask this question, because people are watching and they're saying, why are they talking about Canada? We're not talking about a single-payer plan. Obamacare is not a single-payer plan. What we're trying to do is bring access of health care to the millions of people who don't have it in a competitive system. We're going to have a different system. When in fact, what started as Obamacare-ish in Canada has turned into what Canada is. Right. Why does what Canada has now, what the UK has now, why should we look at that before we jump ship here?
Because it doesn't matter. We're not talking about the single payer system, whether we have one or not. Any program, anything the government does to try to offer equal access, to promise equal access to everyone in the United States with a pulse, is going to create a tremendous new demand on a supply of health care that is very much fixed and cannot be grown overnight and will not be grown. There's no reason why it would grow under a system such as that. But let's say it did. It still takes you a tremendous amount of time to get people through medical school, to build hospitals, to build clinics. So what you're going to do is you're going to entitle people to consume health care with reckless abandon because they're not paying for it. They're not even paying for the health care plan. It's free is the perception. So that's why, and what I did here in Canada, even from people who don't like the system up there, is that it's good with emergencies. It's good if you fall down and break your arm or your leg or something like that. But that didn't impress me much because our system is good with that too. You can be completely uninsured, you can be destitute, you can be a wino in the gutter, and if somebody runs over you with a car, you're going to be taken to an emergency room, patched up immediately, treated quite well, and it's the more long-term, serious suffering that falls apart.
Like the two cases we just saw. All right, for somebody who's watching this, we've only got a couple minutes left, and they're saying, that's Canada. We're not even looking at a single-payer system. What's your comeback?
The comeback is that it's a government-run system, and the details don't matter because what's going on in the bills that are in Congress is that they are making it impossible for profit-oriented companies to offer health care. And so what will happen is it will collapse to only the government-run plan. That's what's happening in Massachusetts. Massachusetts has the same kind of regulation. You cannot buy an individual insurance policy in Massachusetts except through the government-run connector. The only available insurance policies are HMO-type gatekeeper policies where you have a network. It's not good outside of Massachusetts. It's a disaster. You have long waits. You have long waits in every government-controlled healthcare system in the United States. You have waits in Medicare, you have waits in Medicaid, you have waits in the VA. Government cannot run healthcare. If you want to have healthcare access for everyone, the solution is cash. Do a food stamp program where you give cash to the individual.
Would it be fair to say, we've only got a couple seconds left, would it be fair to say that if we pass something like Obamacare, we are setting ourselves on the road to Canadian care, period?
I would think so, almost absolutely.
Yes.
All right. That's going to be it. Thank you so much. If you want to, you can check out those videos at the Independence Institute website. Tell a friend and listen for me late nights on 850 KOA. We'll see you next week.
I mean, you keep on talking, but you don't know where to turn it off.